Hello everyone, I'm Dr. Tan Ing Hian, Obstetrician and Gynaecologist. One of the most common questions I get in clinic is, Doctor, I've had one cesarean section before. Do I have to have another cesarean or can I try for a normal birth? The answer is, you often do have a choice. Today, I'm going to explain what VBAC is, who is suitable, the chances of success, and the risks and benefits so that you can make an informed decision together with your obstetrician. Let's begin. What are my choices after one cesarean? So after one previous cesarean section, there are generally two options. The first is called VBAC, which stands for vaginal birth after cesarean. The second is an elective repeat cesarean section, often abbreviated as ERCS. Neither option is automatically right or wrong. The best choice depends on your previous pregnancy, your current pregnancy, and what is most important to you. My role is to explain the pros and cons of each option. Important factors to consider. Not every woman is the same. Several factors influence whether VBAC is a good option. The first is why you had your previous cesarean. For example, if your baby was breech, that problem doesn't usually recur. But if labor failed to progress because your cervix stopped dilating, the same issue may happen again. Another important factor is whether you have already had a vaginal birth before. Women who have delivered vaginally previously have one of the highest chances of a successful VBAC. We also consider whether there were complications after your cesarean, whether the uterine scar is in the usual low transverse incision, whether this pregnancy has developed any complications, and finally, how many children you hope to have. This last point is important because every additional cesarean makes future surgery more difficult. Chances of success. This is the question everyone asks. What are my chances? The good news is that after one previous cesarean, about 3 out of 4 women who go into labor naturally will successfully deliver vaginally. That is roughly 70 to 75%. Some women have even higher success rates. For example, if you already had a previous vaginal birth, your chances of success rises to nearly 90%. On the other hand, success becomes lower if labor has to be induced. If your BMI is over 30 or if your previous cesarean was because labor never progressed. Advantages of VBAC. So why do women choose VBAC? The biggest advantage is recovery. Women who successfully delivered vaginally generally recover much faster. They spend less time in hospital. They can care for their newborn sooner. Breastfeeding and skin-to-skin contact are often easier. Most importantly, they avoid another major abdominal operation. A successful VBAC also makes future vaginal births much more likely. Risk. Now let's talk about the risk. Every delivery has risk. VBAC has one major risk that everyone should understand. That risk is called uterine rupture. And that's what we will discuss next. During a previous cesarean section, a scar forms in the uterus. In the vast majority of women, that scar remains perfectly strong throughout pregnancy and labor. However, in a small number of women, the scar may separate during labor. This is called uterine rupture. Although uncommon, it is an emergency. It can cause heavy bleeding and may affect oxygen supply to the baby. Fortunately, it happens in only around 1 in 200 women attempting VBAC. That is why VBAC should always be attempted in a hospital where emergency cesarean delivery can be performed quickly if necessary. Comparing VBAC and cesarean. Let's compare both options. VBAC has around a 70 to 75% success rate. Recovery is usually quicker, hospital stay is shorter, future pregnancies are generally safer. However, About 1 in 4 women who attempt VBAC will eventually require an emergency caesarean. Emergency caesarean surgery generally carries higher risk than a planned caesarean. On the other hand, a planned caesarean allows you to choose your delivery date. The chances of uterine rupture is extremely low, but every caesarean leaves another scar. As the number of caesarean increases, the risk of placenta accreta, placenta previa, and surgical adhesions also increases. Understanding the numbers. I'm not going to read every number in this table. Instead, I would like you to understand the overall picture. VBAC slightly increases the risk of uterine rupture. Elective caesarean slightly increases breathing problems in newborn babies. Emergency caesarean after a failed VBAC carries more complications than a planned caesarean. The important thing is, most pregnancies have good outcomes whichever option is chosen. This is an important counseling point shown in the comparison tables throughout these slides. Recovery is another important consideration. Women who successfully delivered vaginally usually returns to normal activities much sooner. Hospital stay is around 2 days. After a caesarean, hospital stay is usually longer. Full recovery often takes around 6 weeks. Heavy lifting should be avoided during this period. Future pregnancies. If you are hoping for several children, this slide becomes especially important. Every successful VBAC reduces the need for another uterus scar. Women who have one successful VBAC have around a 94% chance of another successful vaginal birth in the future. By contrast, multiple caesarean increases the risk of placenta previa, placenta accreta, and dense scar tissue. So let's summarize today's discussion. After one previous caesarean, most women have 2 safe options. Around 3 out of 4 women attempting VBAC will have a successful vaginal birth. The biggest benefit is a quicker recovery and avoiding another major operation. The biggest risk is uterine rupture. Although uncommon, it is serious, which is why VBAC should always be undertaken in an appropriately equipped hospital. Ultimately, there isn't one correct answer for every woman. The right decision depends on your previous delivery, your current pregnancy, your future family plans, and your personal preferences. This is a discussion you should have with your obstetrician. I hope this video has helped explain VBAC in a simple and balanced way. If you found this useful, please like the video, subscribe to the channel, and leave your questions in the comments below. I'm Dr. Tan Ing Kian. Thank you for watching, and I wish you a safe and healthy pregnancy.